Please move to your station and begin your encounter.
Hi.
Move to your station and begin your
Good morning,
encounter.
sir. I'm Dr. Ali. Mr. Brennan, nice to meet you, sir. I'll be your physician today. So, Mr. Brennan, what brings you in today?
I was told to get a recheck on my blood pressure because it was high the last time I was in the ER, and I thought it might have been because of the Fender Bender I had, and plus the action going on in the ER. So they said that this may not be a normal blood pressure, and so I'm just doing a follow-up for that.
Okay. So you have a regular primary care doctor?
I haven't seen a doctor in like 10 years.
Okay. All right. Do you recall what the pressure was?
Like 150 over 90 something.
Okay. And this is the first time you noticed that you were told that your blood pressure was high?
I was in shock.
You were in shock.
Because I had no idea that I had high blood pressure.
Okay. Well, blood pressure is still high on this visit as well.
It is.
So that's why I wanted to talk to you more about this. So no previous history of having high blood pressure?
No.
Okay. Do you have any problems with the heart? Anything?
No, I haven't had any signals at all that I had a problem with high blood pressure. No chest pain or no shortness of breath.
Okay. Never like that. Do you have a family history of high blood pressure?
My mom's still alive. She's 75. Just started having some high blood pressure, but
Okay.
She's old. I mean, she goes along with that, but no, not really.
Okay. And your brothers and sisters?
No, I have a sister that's a diabetic,
Okay.
and my dad died. He died at 65. He had colon cancer.
Okay, colon cancer.
Yeah.
Okay. All right.
Well, that's another thing they told me too when you do a colonoscopy.
Okay. Right. You're over the age of 50, and that's one of the
Especially since my dad had colon cancer. So I already had that.
Okay. Now, I wanted to know actually what was the reason that you were taken to the ER, that you were involved in a motor vehicle accident, is that right?
Yeah, I was coming back. We fish a couple times a month up in Calaveras, and coming back, and I've been fishing like 6 hours. I was pretty tired. It was hot out there. And I've traveled the road all the time. You know, it's not a new road to me. It wasn't wet.
Okay.
I just went around the turn too quickly and lost control of my vehicle, slid into the ditch, sideways. I was the only one in the vehicle.
Okay.
And then I got out of the car, called my wife on my cell phone, told her what happened. She said, let me come get you, and we'll take you to the emergency room.
Okay.
Make sure you don't have any internal injuries or, everything's okay.
Okay.
So we had my car took in to a buddy's garage, and so all my abrasions and everything have been cleared up. My neck is pretty much healed. It's got a little twinge in it,
Okay.
but no internal injuries.
Okay, so I'm very glad that those injuries are healing up. Can you take me back to what were you doing? So you mentioned you were fishing at the time with some buddies? Okay. Now, were you drinking at the time?
Yeah, I had probably 5 or 6 beers. Through the course of 6 hours, but we always cook a good meal too, to make sure we get food in us, so that that we don't drink and drive or we're over the limit.
Okay. So this kind of brings me back to some of the things that I did want to talk about. So this accident was kind of related to your alcohol use because you were drinking before it. I just kind of wanted to talk to you about, get a gauge of your alcohol intake habits, if that is okay with you.
Sure.
Okay. So in the past year or so, how many times have you had more than 5 drinks in a day?
I would probably say once or twice a month.
So you have.
Yeah.
All right. And how many times would you say you drink in a week?
Beer in a week? I only drink beers. I don't drink anything else. Probably, if I added it up, maybe 20 beers. 20
beers in a week? Okay. All right. So that's actually, medically speaking, that's actually quite a substantial amount. Because for a male, generally, the okay limit is more like 14 drinks in a week, or up to two drinks in a day.
Okay.
So you're over that limit. Okay. Now I kind of wanted to talk to you more about this. Is that okay?
Yeah, that's fine.
Okay. Now, so this accident was kind of related. It kind of happened with your while you were drinking. So it's kind of related to your alcohol use. Have you ever had any previous problems with alcohol other than this?
As far as getting in an accident?
Mm-hmm.
Well, I dinged up to my garage door one time.
Okay. So, any other medical problem like?
No.
Okay. But this is something which is related to your drinking. Do you think you're unable to meet your social obligations because of your drinking?
No, I mean, because I don't really drink to get drunk. I mean, I just drink beer, and just a bonding, male bonding thing. It's not like, you know, we're in a contest to see how many beers we can drink. I don't go to bars and hang out, you know, so it's, like I say, it's just a couple of times a month, or when I'm golfing or fishing, might have a few beers.
Do you have family at home?
I have a wife and 2 boys.
Is she aware of your drinking habits?
Oh, yeah.
Is she
Yeah.
okay? Does she say anything?
Oh,
Or
yeah, she's not happy.
She's not happy?
Well, I say she's not happy. She's not really a nagging type person,
Uh-huh.
but she throws some darts once in a while at me because I fall asleep
Okay.
in my chair over there, and
Yeah.
that doesn't set well with her. She wants to talk about her day, talk about the boys,
Right.
and after 2 or 3 beers, you know, I'm knocked out.
I understand. Have you had any legal problems because of your drinking habits?
No.
Okay. Any arrests or anything like that?
No.
Okay. All right. Now, a little bit more. Do you ever find that you're drinking more than that you want to drink, that you set your goals on?
I don't know. I don't look at it that way, I guess, because I might drink 2 to 3 beers a day. Sometimes I don't get to the 3rd beer, and I might drink 5 or 6 beers on the weekend if I'm watching a ball game, or if I do go fishing.
Mm-hmm.
But I don't usually exceed that.
Okay. So do you ever feel like you have to drink, otherwise you will get nauseous, you start sweating, tachycardia, or something like that?
I never really thought about that because, you know, I never really stopped drinking,
Okay.
so that really doesn't enter my mind.
Okay. But do you have that urge to drink most of the time?
Hmm?
Do you have a constant urge to drink?
Yeah, I like beer. I mean, I think it's just more of the taste of beer. I don't drink soda. I don't drink, you know, any other beverages but beer and water.
Have you noticed that you have to drink more to kind of provide enough
3 minutes
alcohol
remain
to
for
your
this
body?
station.
No.
3 minutes remain
All
for
right,
this station.
but based on your answers, I think you have an alcohol use disorder, and I think it would be important, wise for you to quit drinking. I think your high blood pressure, your recent accident, motor vehicle accidents, and when hitting the garage door are kind of related to your alcohol use, and I think it would be important for you to quit drinking.
Yeah, I'm not ready to stop. I may cut back, but I don't know that I'm ready to quit.
Okay. What do you think are some of the reasons you are not ready to quit drinking?
Well, first of all, I never tried to quit drinking, so I don't know that that's, you know, possible just to flip a switch like that.
Okay.
So I'm going to have to put a plan together
Okay.
with you
Right.
to get me to that point, because it's not something I don't think I can just stop.
Right. So, Mr. Brennan, I'm here to help you go through this process. And I know it's hard. You've been drinking for so long, but I think this is a problem. And I not only want you to cut down, but I would insist on quitting. We can maybe work on some of the things that you can do to quit drinking. Maybe you can not kind of. Do you have friends who are not drinkers?
No.
You don't have any friends. Okay. Perhaps you can try something else other than drinking to spend your extra time with. Maybe you can spend extra time with your family and try and reflect on things that you can do other than drinking to pass your time, or to socialize, or to spend time in. So what are the things that you would be willing to try?
I don't really have any hobbies except golfing and fishing,
Okay, good.
and I don't really do anything else.
Okay.
I mean, watch TV, and that's pretty much it.
Okay. So I want you to come back to my clinic maybe in a couple of weeks' time, thinking about some of the things that you can try in order to avoid alcohol consumption. And I definitely want you to cut down during that time. And then maybe we can work on a plan, because there are benefits of not drinking. You would avoid the high blood pressure, constant, you could have potential problems with the law and avoid accidents. And obviously, it's a difficult process, and it may take some time for you to get over it, but there are advantages to it. So I want you to start thinking about that and come up, and both you and I can come up with a plan to alleviate and make the process as easy as possible. Okay, and maybe you can bring in your wife next time, and then we can ask her to help you go through the process. Have you ever tried a group intervention, something like Alcohol Anonymous?
No, I really don't do the group thing too well, so I'd rather not do that.
because that is something which is shown to be very effective.
End of encounter.
All right, sir?
Please step
So
out
I'll
to
see
the
you
hall.
when you're fine.
End of encounter. Please step out to the hall. Patients, please return for feedback. Patients, please return for feedback.
So how do you think you did?
I think I had to rush a little bit. I wasn't able to accomplish all the things that I had planned in my mind.
Okay.
So time management was a real issue, a little bit of a concern. But otherwise, I think I did okay.
Well, you covered most of what I had on my checklist, which is unusual. Usually people don't get to certain questions on there, but you did a pretty good job with the interviewing process. I probably felt a little bit more like you were judging my drinking now, maybe a little bit too aggressive. Kind of be careful with that because alcohol is a very reactionary. Now, had I had more time in this scenario here, I would have probably went after you a little bit and been a little bit more rebellious to you, because that's what people would do if they're uncomfortable talking about a habit that they're maybe thinking they don't have a drinking problem, in other words.
Right.
So it's hard to convince somebody like this person that has a drinking problem because they don't go to bars, they don't feel like they're, trying to get drunk or anything, just they like to taste a beer. Well, that's baloney. And you know that as a doctor, you can't sell that to a doctor. You shouldn't be able to sell it to a doctor. I like the idea that you talked about some alternatives and talked about some pros and cons. The blood pressure obviously is staying up because of the alcohol. Maybe you need to change your lifestyle around. I probably would suggest a diet, exercise, some other things, salt intake. How's your diet? Why are you drinking every day? I would ask that question. Why do you come home every day and you drink? I mean, have you ever just thought about that? Are you hiding from something? Are you trying to escape? You don't want to deal with your kids. You don't want to deal with your wife. Or you have job stress, financial problems, marital problems. I know what the trigger is.
Okay.
What's causing this person to have that behavior? Because this affects the family more than anybody.
Right.
Because he's checked out from the family. And they don't want to bother him. His dad's going to have his beers, he'll pass out. They don't want to deal with him. He's got 2 teenage boys. They need his help. They need his advice. They need to, and he needs to talk to them to find out what's going on in their world. He just can't say where they're in a room and they're doing a computer thing. So get a little bit more involved and find out what is causing this person to have that behavior every day. I thought you did an excellent job and covered a lot of the bases in a short time.
Okay. Thank you so much. I appreciate it.
Okay, good job.
Patients, 1-minute warning. This concludes today's activity. Please remember to pick up your belongings prior to exiting the Clinical Skills Center. This concludes your activity. Please remember to pick up your belongings prior to exiting the Clinical Skills Center. Thank you.